Hi, I'm Connor McCormick, and I'm joined by Dr. Richard McCormick. Thank you for being here. Doctor, what makes you a COVID expert?
I've seen probably around 1,000 COVID patients. Primary care physicians see a lot of COVID patients too, but we see the sick ones because if you go to your primary care physician, it means you're probably not really sick. Some are, they get sent to the emergency department, but the patients I see by and large are feeling very ill. Most of them are near hypoxic or hypoxic and breathing distress. I've intubated patients. I've placed people on high flow nasal cannula. I've done all the things that we need to do emergently to save people's lives with COVID.
Gotcha. So, how has COVID changed the emergency room or the hospital setting?
It's made it very challenging at times, especially when the hospital gets full. Luckily, we've survived now 3 different surges of this pandemic, and we've come out okay, but we've at times been critically stressed to the limits of what our capacity is at the hospital.
Awesome. So, are you vaccinated?
I am vaccinated.
Why are you vaccinated?
I got vaccinated right at the beginning. Your chances of being hospitalized are 29 times more if you're not vaccinated. Your chances of dying are 11 times higher. Now that doesn't apply to people who have natural immunity, at least for some time, but it's something that needs to be addressed with each individual and each individual's doctor, whether you should be immunized or not.
So, would you recommend not only people my age, but even people who are younger, so like grade school, high school, middle school, what is your opinion on the vaccinated, on them, and what is your opinion on masks in school?
So, 2 different questions. The first one is, should young people get vaccinated? That's a harder question. Anybody over the age of 40, especially if you have comorbidities, should be vaccinated, almost certainly, unless you have natural immunity most immediately. But once you get to younger people, especially people who have been around without masks and have been socializing, most of them have a natural immunity. The risk factors are very low comparatively. We have to be careful because if you have risk factors for clotting, if you take into account myocarditis and other inflammatory processes that can happen with children, it's at least worth the discussion with your physician. The benefits don't outweigh the risk nearly as much for young people, so it's worth a discussion rather than just a blanket rule. As far as the mask goes, same thing. We have to ask ourselves, I was recently talking to a reporter about this, and the question was, why don't you wear a mask in the store? I said, well, I'm fully immunized and I feel quite comfortable that I'm not at risk. And they said, why wouldn't you set the example for those people in the store, since there's still people out there who can't be immunized? And right now, anybody who wants to be immunized can get immunized. There's no line that's holding up anybody. And I said to him, well, if that's the standard, then we'll never, ever be out of masks again. So I don't think that's the right answer for America. I don't think there's the right answer for people. People aren't going to tolerate that. We're not going to be wearing masks for the rest of our lives. So therefore, we have to make a choice at some point in your life. Am I willing to go out in public? Am I immunized, or do I accept the risk that I'm taking because I have either natural immunity, been vaccinated, or I just don't really think it's that much of a risk to me? Now, that's once again a discussion you have to have with your physician and make yourself.
Awesome. So, how long do you think this pandemic will last? And if you think it will end, what steps do you think America can take in helping in the pandemic?
Well, we're well into year 2 of this pandemic. The definition of pandemic has been met. It's across several different regions in the world. It is a deadly disease. But let's face it, the flu has been around for over 100 years and still kills hundreds of thousands of people. Sometimes just in the United States, it kills tens of thousands of people every year. In a bad year, 70,000 people could die. And that was recently when we had a bad outbreak of a new variant or a variant that wasn't covered by the immunization that year. This is going to be around for the rest of your lives, for the rest of your children's lives. This is never going to go away. No matter how many good vaccinations you get, no matter how many good treatments you have, it is a virus. It's going to morph, and it's going to be around for the rest of our lives. So we have to get used to it. We have to do things to treat it. We're getting better at treating the very sick people. We're getting good at vaccinations, and we're also coming up with some new oral medications from Merck and Pfizer that should be helpful.
So do you think Dr. Fauci is the guy to lead the charge?
I think it's very dangerous to have any one doctor looked at. I mean, this isn't a church. This is a scientific group of people who do this for a living, and each person has their own unique experiences they bring to the table. When in the past we've tried to rely on one medical professional for a standard, it usually hampers progress, not helps it. For example, there was a Dr. Lister who believed that doctors should wash their hands and use antiseptic on their tools before they did surgery, and people scoffed at him.
Awesome. So me being fully vaccinated, I'm young. I feel like I'm pretty healthy. What can we do to prevent getting COVID, or at least when we get COVID, how do we minimize the side effects and effects of it and make sure we stay, in tip-top shape?
So first of all, just make sure you live a healthy lifestyle. Eat well. Your nutrition affects your ability to resist disease. That means get a vitamin that has both zinc, vitamin C, D3, which is either you can have D and then convert it to D3 by being out in the sunshine, or by just taking D3 is a little more expensive. Make sure you're fit. Your cardiovascular fitness is going to affect directly how well you rebound against this disease. Make sure you wash your hands, that you're not around people who are symptomatic. So when you do get a viral load from somebody, it's a low viral load, so it keeps your immunity, but doesn't actually make you sick. Make sure that if you are a person who's not immune and has some sort of health condition, that you stay away from people who are sick, and you should be vaccinated unless there's some reason not to. Those are all great ways to stay healthy.
Gotcha. Well, thank you for being here today, and we appreciate your time.
My pleasure.